Hello, my name is Dr. Tarush Rustagi. I'm an adult and pediatric spine surgeon, and today I will be speaking about scoliosis. Scoliosis is basically deviation of the spine from its normal alignment. As can be seen in this model, when we look from the front side, our spine is like a straight line. Any deviation of the spine, especially more than 10 degrees either to the right side or to the left side, is termed as scoliosis. There are large number of causes of scoliosis. The most common cause is idiopathic, for which there is no reason that is known. However, there are certain amount of scoliosis that have a very distinguished reasons for developing. It is important to identify these patients who have an underlying cause because these cases have a tendency to rapidly progress with time and may need a very careful observation or an early intervention. The large majority of patients of scoliosis are idiopathic, that is, that they do not have any underlying cause. Sometimes these patients can be picked up early in their life within 10 years of age, and that is often uh, picked up by the parents when they note a slight deviation of their spine. Often these patients present in adolescence when they notice either the prominence of the rib hump on the backside, asymmetry of the breast in females, or asymmetry of the shoulders with one shoulder being higher. The symptoms of adolescent idiopathic scoliosis are often very benign, and it is mainly cosmesis where the parents or the patient complains of asymmetry of the shoulders or of the backside. Very rarely, in very severe cases of idiopathic scoliosis, it can be associated with some breathing problems. The treatment of idiopathic scoliosis depends on a large number of reasons. It depends on the type of curve, it depends on the age of the patient, it depends on the certain measurements, how severe the curve is, it depends on the maturity of the patients. Based on some of these factors, we are able to predict how much this uh, scoliosis is going to progress later in life and how much problem it can cause later on. Based on these measurements, treatment can be discussed with the parents and with the patient, and it can be a careful observation. It can be bracing. It can be casting in some patients, and if need be, surgery is discussed.